Okay, hello, my name is Ben, and I'm here to talk with you today about a very big bridge, a very big gap we have in our health ecosystem today. So, I want you to picture this. Somebody just had a very bad motor accident and they rush the person to the hospital. By the time the person gets to the hospital, they discover they don't really have much information about the person. They don't know his genotype, they don't know his health status, they have no information about the person, and because his records are not in a nearby hospital, they have to run fresh tests on the person to know his genotype and other things about him before transfusing blood. This person who just was involved in that accident has lost a lot of blood and is at the verge of losing his life. But because they have no other option, they have to run those tests. And by the time they are able to run the test, they are able to successfully um, transfuse the blood. But what if that person died? That is one of the problems that we face in Nigeria because there is no one single platform that has the ability to have all health records all in one. And because of this, thousands of Nigerians die yearly because they don't have access to medical histories that are transferable from one hospital to another. And that's exactly why we built CareLink. So CareLink is basically a unified health platform that has all the details, all health details about a patient all on one platform. So it serves as a bridge between patients and hospitals. So for patients, if they want to carry out tests, they want to um, have a consultation, they want to have an appointment, they want to go to the hospital for anything at all, they have one platform where they can go to, and just with a single number submitted to the hospital, they'll be able to have all their health records accessed without having to go through the stress of having to go and search for their file in the hospital reception or do anything else. We also added some other extra features where the user can interpret using Gemma 4. Gemma 4 is directly integrated into this platform. So using Gemma 4, the patient can do things like snap prescriptions that the person may not understand, and the AI interprets it for them. The person can also do things like approve access, give limited access to whoever he or she wants to access the health records that is on the platform. We also built for the health institutional side where they can manage all their patients' records, lab tests, and every other thing that concerns the patient's health record all from one platform. And for the doctors, there is an AI assistant, AI clinical assistant, as you can see on my screen, that helps the doctor understand who this patient is and all the things about the patient all in one summary. One key advantage of using Gemma 4 in this platform is that Gemma 4 is totally offline. So in places where there is very poor network connectivity or no network connectivity at all, somewhere like GK, the person will still be able to use the platform without running into the issue of looking for network or doing any of these things. So our goal is that we want CareLink to be like the BVN but for health in Nigeria. So basically, if you walk into any hospital with your CareLink number, you should be able to have equal and easy health access and treatment just with that number. Because with that number, they'll be able to access all the details that they would have accessed if they were using a manual file system, but even in a more efficient way. That's basically what we are solving with CareLink, and thank you for watching this presentation.